Hi guys, welcome back to my channel. I am Nurse Bae Britt, and in today's video I will be discussing what it's like working as a plastic surgery nurse practitioner. So for those of you who are new to my channel, first, I am a third-year nurse practitioner student. I am pursuing my doctorate degree in the specialty of acute care adult gerontology. In this fall semester, I had the wonderful pleasure of completing my rotations in the plastic surgery specialty, and my preceptor is a board-certified plastic surgeon who employs at his practice a nurse practitioner and then a bachelor's prepared registered nurse. And so I was able to see it from 3 points of view, right? The plastic surgeon, the nurse practitioner, and then the RN that works with him. 10 out of 10 experience. I'll go ahead and tell you now. And I saw a lot of real cool things. He does anything plastic surgery, and then he also specializes in hand surgery. So I was able to see facelift patients, neck lift patients, upper eye and lower eye blepharoplastic patients. I was able to see abdominal liposuction, thigh lifts, breast augmentation, breast reconstruction. So it was a lot, and it was all just a great experience. And the nurse practitioner and the RN that works with him, they will see a lot of the pre-op patients. So when they have already come in for a consultation, they come in, they meet with the plastic surgeon, they discuss their goals, or they discuss, if they are a breast reconstruction patient, they discuss whatever their treatment plan is for their cancer before proceeding forward with reconstruction plans and things of that nature. So they meet with him first, and then they schedule a pre-op appointment. So the first meeting is like a consultation, and then they schedule a pre-op appointment whenever they decide that they want to go through the surgery. At their pre-op appointment, that is when they meet with the nurse, either the nurse practitioner or the RN at the practice, and they go through all of their consents, sign paperwork, take pre-op pictures, discuss the surgery plans, things of that nature. And then towards the end of their pre-op appointment, that's when the plastic surgeon comes back in and just reviews everything with them, because at that point, the next time they will see the plastic surgeon will be the day of surgery. And so it is the nurse practitioner's job to make sure all of the consents are signed, all of the paperwork is in place, so that the day of their surgery, there's no delays. Any medications that need to be sent over, that includes pain medicine, anti-nausea medicine, if there's any antibiotics they need to take prophylactically, anything like that, the nurse practitioner has to make sure that those prescriptions are sent over so that they can have those medications prior to the day of surgery. So that way, when they get out of surgery and they go home, they already have everything at home. They make sure that the frequency of how often they should take each medication is discussed, and also post-op care. So if, let's say, they get a facelift, post-op care of when can you wash your face with this type of face wash, what type of creams you can use, what to do if you have pain, things like that. If you have drains, post-op care about the drains, how often you should empty your drains, recording the output, and making sure you bring all of that to your follow-up appointment so that we can know when to take those drains out. Also reporting any signs or symptoms of infection, things like that, reasons to call the office. So that is all roles of the nurse practitioner in the pre-op visit with the patients. Now, post-op, the patients come in either 1 week post-op or 2 weeks post-op. A lot of times it depends on if they have drains. You usually want to see them 1 week after surgery. If they don't have drains, you can push it to 2 weeks after surgery. They come into the office. It's an in-person visit. Usually they come into the office, you look at how much their drains are putting out if they have drains, you look at their surgery sites, if they have stitches. If they don't have dissolvable stitches, then you determine which stitches can be cut versus which ones stay. And a lot of these things is pretty standardized at his practice, like he has it written down. Okay, if this amount of output is coming out of the drains within 24 to 48 hours, don't take them out versus do take them out. What stitches need to be taken out in 2 weeks versus what stitches need to stay. And so it's pretty clear what is expected of the nurse practitioner by the plastic surgeon as well. So it's not like you have to make every single decision just independently. It's collaborative, right? And so when they come in, you take out stitches as a nurse practitioner, you take out drains, you review their incisions, make sure everything is healing good. You take pictures. So you always want to get pictures. Every appointment they come in, post-op follow-up appointment they come in, you want to get pictures so that you can monitor their progress. And the pictures go in their chart, and they are aware of that. And so you want to get pictures the same way each time. So the only way you can really tell if a surgery yielded the ideal results is you need to have the same type of lighting, the same type of background, and the same type of clothing each time you take pictures of that patient, so that the pictures and the progress can be consistent. So for example, if I want to take pictures right now and this is my background, and then 2 weeks later I want to show you all, progress of me using a new face product, I need to have the same background, the same type of light, so that you can actually see and not switch things up, because then it can be kind of hard to tell. And so that is a whole logic and theory behind that. And so when they come in, you want to make sure that you get pictures, and you schedule their next follow-up appointment. A lot of times they might be a little further out if they're doing well, things like that. So that's for the surgery patients, right? And then you have another side of plastic surgery, which is more the cosmetic side of injectables. So that is something that is more driven by the nurse practitioner. Like, you bring in your own clientele, and sometimes you get clientele from the patients that get plastic surgery, but they don't have to be getting plastic surgery to be a client, of course. So you have your own clientele. You need to be doing your own promotion, so people know that, hey, I'm doing injectables, I'm doing, offering these type of services, come in and try it. And so on days that are not surgery days, when I say surgery days, like days that patients aren't coming in post-op for post-op appointments and things like that, because usually they come in on the same days that the plastic surgeon is in the office, because if there is something that comes up, a complication or whatever, he has to be there so that he's easily accessible to come in and see the patient. And a lot of times the first follow-up visit, I forgot to mention, the first follow-up visit after surgery is with the plastic surgeon, and then the preceding visit can be with the nurse practitioner. And so it usually alternates like that. And back to the cosmetic side. So as a nurse practitioner, you're doing injectables. So that's Botox, that's dermal fillers. You're doing skin treatment. So that includes microneedling, Morpheus 8, chemical peels. It's a lot of different things you can do, and you pretty much drive your own schedule, your own clientele as far as that goes. And it's so exciting because the same thing that you do with your surgery patients, as far as taking pictures to monitor progress, you do the same thing with your cosmetic patients that are getting more of your med spa type of treatments, because you still want to monitor the progress. Is this working? Is it not working? Me personally, I tried microneedling for the first time. I had never tried it, but I always wanted to try it. I haven't tried the pill yet, but that's on my list. But I was able to see great results, but I wouldn't be able to tell that had I not taken pictures before and after and continue to monitor my progress. So that's another thing that you do as a plastic surgery nurse practitioner is, a lot of the injectables and skin treatments and things like that. And so overall, I think it's very rewarding, because you have patients that come in and they may have a certain concern or something that's just like an insecurity of theirs that they really want fixed or worked on or just enhanced or improved. And as a plastic surgery nurse practitioner, you are able to provide them with that. And so you have someone coming in feeling one way, and then once they leave your care, they're feeling another. They're feeling more confident. They're feeling more empowered, more secure. And so to me, that is very rewarding, because it's the little things sometimes that makes the biggest difference. So overall, like I said, 10 out of 10 experience. I think working as a plastic surgery nurse practitioner has a lot of fun moments, because it's very rewarding and you get to be very creative. Everybody's face and anatomy is not the same. So you get to be very creative when you start doing your injectables and your skin treatments and things like that. Now, keep in mind, depending on what plastic surgery setting you're in, some treatments may not be offered, because it could be something as simple as maybe they don't have the machine. So for example, one plastic surgery office may offer laser treatments, and as a nurse practitioner, you can do laser treatments, and then you know, maybe another office does not offer that service because they don't have the laser machine. But as a plastic surgery nurse practitioner, you can do it all. It's just a matter of getting trained and feeling comfortable using the device and providing the treatment for your patients. So that is the rundown of what it's like being a plastic surgery nurse practitioner. This was such a fun rotation, you guys. Like, it was so fun. Like, every time it was, you know, the morning where I had to get up and go, I was always excited. I never dragged, or, you know, just, you know, sometimes some jobs you work, you may just not get excited about it anymore. I was always excited every time I went into here. The energy was great. The people were great. The patients were amazing. My preceptor was great. I learned a lot from him. But I want to make this video more geared to the nurse practitioner side of it because, like I said, he's a plastic surgeon. So, of course, there's so many more things I could go into detail about on the actual plastic surgeon side. But I'm not going to be a plastic surgeon, so I want to focus on the nurse practitioner side of it. But it was a wonderful practice to do my clinicals at, and I 10 out of 10 recommend, if this is something that you're interested in, finding someone that allows you to shadow them, or if you're in school and you're looking for a clinical rotation site, look into some of the plastic surgery centers around you and see if someone is willing to take you on as a student, because you'll be surprised. It was very hard for me to find someone at first that was willing to precept me as a plastic surgeon, and then once I found someone, I held on to them because I was so excited. So I understand, I empathize that it can be hard when you get into some of these very like glamorous specialties to find someone who's willing to teach you, but don't let the no's discourage you or anything. Keep trying, keep, you know, asking around, and you will be surprised. So I hope this video was helpful, and I just wanted to kind of give you guys a quick, you know, update on really how life has been so far in a while. And I will have to do a separate video on how the DNP program has been so far, because this semester, you know, it did get real. It did get real for me, but I just want to focus on the clinical aspect of plastic surgery and as a plastic surgery nurse practitioner. So I hope you guys found this video helpful. If you have any questions, please feel free to place them in a comment box below. And don't forget to like and subscribe. Turn your notifications on so when I do post my next video, you will be the first to know. Thank you guys for watching. I'll see you soon.